Hello, my name is Elizabeth. I'm the student nurse. Can I verify your name and date of birth? Your name is May Martha 7/23/2001. Yep, that's correct. That's what I have here. So I understand today we're going to do medication administration. Do you have any pain today on a scale of 0 to 10? None being 0, 10 being the worst. None. Okay, that's perfect. Do you have any allergies or anything that I should be aware of? No? Okay. So I understand that the medication you're taking today is fluoxetine. This is for your chronic depression. Are you familiar with this? Yes. So some side effects are like a headache, some hot flashes, and you will be taking this in the morning at 8 a.m. And then the next one is insulin for your type 2 diabetes. The insulin, you do it twice a day, and then the insulin Lispro, you do it 3 times a day with breakfast, lunch, or dinner, but for this, it'd be for breakfast. And this would also be at 8 and then 7:30. And then cefuroxime, this medication is for your UTI. You prescribed it for 5 days. The side effects are dizziness and nausea, and then cyanobalamin. This is an injection once a month for your vitamin B12 deficiency. Some side effects are diarrhea and a rash. And then the last one is a TB skin test. So what we do is we poke your skin on like your forearm and you get a little bump, and then you come in 48 to 72 hours to have it read, and if it's positive, then we go and I would contact your provider then. And so I'm just going to go ahead and sit you up. And also I'd provide any patient privacy if needed. So I'm sitting her up to make sure that she will be in a comfortable position to take her medication. Okay, so for the fluoxetine, this is for your chronic depression, so this would just be capsules. So are you able to swallow for me? And she's not having any difficulties, so I think she can do that. And then like the insulin would be in the subcutaneous, so that would be in the stomach. You would inject it in the stomach and you'd squeeze the skin, and you go like 45 to 90 degree angle, like 45 for skinnier patients and then a 90 for heavier patients. And then the intramuscular, so this one would be for the UTI or the vitamin B12 deficiency. So we could go in at her deltoid or her ventral gluteal, which is like right here, her side, and then like I said, the deltoid. And then the TB skin test would be like right here on her forearm, and then she would just have a little bump. But I'm going to go ahead and provide you some privacy, and I'm going to go ahead and wash my hands, and I'm going to go ahead and start my dosage calculations for medication administration. So I sanitize my hands, and then right here I'm going to go ahead and do my calculations. So right here we have fluoxetine, so it would be 60 milligrams. And then we do that, and I look over here, and it's 20 milligrams. So then that would just come out to 3 capsules. And then the next one would be the insulin, the NPH, so the cloudy. So I go ahead and write that. And then for the insulin Lispro, you go ahead and put 2 units for clear. And then this will come out to 12 units total. And then the next one will be Serapine. So this is for the UTI, and so we have to convert, let's see, so Suboxone. So we have to go from milligrams, so go 500 divided by 350. So then this would be 1.4 milliliters I would inject um, in the deltoid, and then take out 2.1 milliliters from the ampule, and then for the cyanbellum, so the vitamin B12 deficiency. So right here we have 200. We have 200 mcg over 1,000 mcg. So then that would just come out to 0.2 ml. And then for the TB, it would just be 0.1 because that's a skin test. And then my calculations. And then, okay. So now I'm gonna come right here and I'm gonna prepare everything. So I would sanitize, wash my hands, put on my gloves before I begin, and let's see. So the capsules would be in a little package, so I just poke out 3, and as you can see here, I have 3. So I'm gonna go ahead and go over there and give it to her for her chronic depression, and I'd also have a cup of water. So, hello, so here's your 8 a.m. Medication for your depression. So you have 3 capsules. You are able to take it by yourself because you're independent, so I'll just give that to you. And then here's some water. Okay, and then I watched her, making sure that she took it okay, and everything seemed good. Okay, and then the next would be the insulin. So I'm gonna go ahead and open up my alcohol pad. So open up my alcohol pad, and I go ahead and clean the tops of the cloudy NPH insulin and the clear insulin. Give it like 10 to 15 seconds to dry. And then I would go ahead and take my insulin needle, and I go ahead and go 10 units of air. And then I go ahead and I poke that in, and then I inject the air, and then I pull out. And then I would go ahead and get 2 units of air, and then I go in, and I would also push that, and then I pull out 2 units of clear, and then I come over here and get 10 units of cloudy. So then I should have a total of 12 units, and I would have a second nurse come check to make sure it is correct. And I'd flick it for any bubbles or anything like that. So as you can see, 12 units of insulin. And I would do my patient's right. So right patient, right medication, right route, right time, right documentation, and I believe that is it. And then I would go ahead and clean the area where I'm going to administer this medication, and that would be in the subcutaneous, so that would be like in the stomach. And so I go ahead and clean the area and wait 10 to 15 seconds for it to dry. And I'll go ahead and pinch the skin, and like I said earlier, 45-degree angle for like a skinnier person, and then like a 90-degree angle for a heavier person. But for this video, I'm just gonna go in at a 45-degree angle. So just go ahead, inject it, and then I'll discard this into my sharps. Okay, so now that is done, the insulin. Okay, and I'm gonna just remove these. That way I don't get mixed up. Okay, and then the next one is I'm gonna go ahead and open the ampule. But I need to get the ampule opener to open it. So I'm just gonna go ahead and open the ampule. Oh. Okay, and then I just discard that, and then I would go ahead and take out 2.1. So I go ahead and do 2.1, and then so let me see. And then I make sure there's no air bubbles or anything like that. And then I discard this in the sharps. And I go ahead and flick it. Make sure it comes up to 2.1. And then I would reconstitute that with this for the UTI. So go ahead and inject that. And then this, I would just go ahead and roll. And also I would do that with the insulin for the NPH for the cloudy. And then I will go ahead and inject 1.4 out milliliters. And for this, I'm using the filter needle, but in the real world, I would not. I would, but I would switch it to another needle. So then I need to get 1.4 milliliters, and I checked with the dosage, and I made sure my container was right and it wasn't expired. So go ahead and take out 1.4. So let me see. I'm gonna make sure there's no air bubbles. Okay, that would be 1.4, and then I'll go ahead and flick it, make sure there's no air bubbles, and then I check, and I do my 3 checks, so one at the station, and then one at the door, and one at the patient's bedside. So again, right patient, right dose, right medication, right time, and making sure everything's not expired. And I would also document. And so for this is for the UTI. So I go ahead and administer this in the deltoid. And so I go ahead and open a cloth, an alcohol cloth, and I clean the area site of injection. And then I discard that, and then I would go ahead and stretch, and I would go from the shoulder 3 finger lengths down, and I go ahead and go in at a 90-degree angle. So then I inject that, okay, and then I would discard my needle, okay, and then now we are going to do the vitamin B12 deficiency. Intramuscular. So this one I'm going to do on the virtual gluteal. So on the side, and this one will be 0.2 milliliters. So I would go ahead and I would clean the medication first, wait 10 to 15 seconds, and then I'll discard that. And then I would go ahead and get 0.2 mLs. So be just very little. So yeah, 0.2 mLs, and I do my my checks and making sure my dosage lined up with what is needed on the label, and make sure, verify that twice, and then I'll clean the area site for injection. like I said, on the side by the gluteal, the ventral gluteal, clean it, and then discard that, wait 10 to 15 seconds, and I'll use the Z-Track method again, and I'll go ahead and inject that at 90 degrees, okay, and then I would go ahead and put the safety cap needle on, and I'll discard that in the sharps bin, and then the next will be the TB. So I will go ahead and clean the top, and then I'll discard that, wait 10 to 15 seconds, and then I will go ahead and open my TB syringe, and I'll pull out only 0.1 milliliters. So I go ahead and do 0.1 and make sure that is right. I'll check it over here, make sure I have the right patient, right dose, right route, right time, right documentation, and make sure everything is right, my 6 patient rights. And I would go ahead and clean the site first. So I'm gonna go for this one, and this is just a poke in the forearm, and then they'll come back in 48 to 72 hours. You go in at like a 15-degree angle with the bevel up, and make sure it's full, and then you pull out, and then I discard this into my sharps. Okay, and then I would go ahead and remove my gloves, and I would discard those, and then now I'm gonna go up to the patient, and I would ask her if she is comfortable, if she needs anything, how she's feeling, see if she has any questions or concerns about the medication, and I would get her in a comfortable position. And then I'll hand her her call light and just tell her to call me if she needs anything. And then we're gonna go back over here because I was gonna document everything at the end to make sure I administer everything. So we did the chronic depression at 8, we did the insulin at 8, and then the insulin glycerol at 7:30, and then the UTI, and then and then the vitamin B12 deficiency, and then the TB. And so you can see right here, I documented it all. And so I'm going to just take a second and see if I missed anything. And also I provide the patient privacy again. I'll check the door and make sure everything went well. So I'm just going to take a minute and think. Like I said, with the insulin, the NPH, I would roll it before getting any medication out or even put an air in it. And then, yeah, let's see. But yeah, I think that is it.